Welcome to the Safe States Alliance IVP 360 training series. This session will focus on introducing injury and violence as a public health problem. My name is Catherine Guerrero, and I'm a principal at Health Management Associates. I've been working in injury and violence prevention for more than 20 years. I've worked in nonprofit community-based organizations, state health departments, and in the private sector as a consultant, implementing programming, conducting evaluations, and providing training and technical assistance to public health professionals across the country. Injuries and violence represent a leading cause of death in the United States. It costs more than $800 billion annually. That's the equivalent of 85% of the yearly US federal deficit. Nearly 250,000 people died as a result of injury and violence in 2018 in the United States, and more than 27 million people were treated as a result of non-fatal injury and violence-related incidents. Injury and violence take a serious mental, physical, and financial toll on those impacted and their loved ones. The full financial and social impact is immense when one considers the medical care, the loss of work and productivity, the loss of life years, and the cost of a criminal legal response. Beyond the immediate and direct impacts, research supports a strong link between injuries and violence and later development of chronic diseases. This is largely due to the toll of toxic stress resulting from injuries and violence on the brain and the body. Toxic stress is a type of stress that results from a severe or repetitive trauma. It can result from a variety of injury and violence stressors, including child maltreatment, bullying, interpersonal and community violence, just to name a few. Toxic stress can also result from circumstances faced by people who experience lower socioeconomic status and racism. This last point is important because we know communities of color in other communities who have historically had less access to public health resources are more at risk for these types of stressors. And at the same time, these communities experience higher burdens of injury and violence. Understanding these disparities is fundamental to injury and violence prevention work. This means health equity and the application of a health equity lens to our prevention efforts must be a priority for all injury and violence prevention professionals. Injury and violence prevention work is broad, and there are a number of public health issues that fall under its umbrella. These issues are often categorized as unintentional injuries, which are injuries that are unplanned and typically preventable when proper safety precautions are followed, or intentional injuries, which are injuries resulting from purposeful human action, whether directed at oneself or others. Unintentional injuries are the leading cause of death for Americans ages 1 to 44 years old. Some examples of unintentional injuries include things like unintentional poisoning, carbon monoxide, or drug overdoses, motor vehicle crashes, falls, drowning, as well as other injuries, including getting hit by something falling, injuries that happen on bicycles, or injuries experienced by pedestrians. Intentional injuries or violence can have significant impacts on individual and community well-being. These are things like homicide and suicide, rape and sexual violence, domestic violence, youth violence, and bullying. It's true that everyone should be safe from injuries and violence, but our country has long established systemic barriers rooted in oppression that result in people of color, those who are economically disadvantaged, those who are geographically isolated, and those who are lesbian, gay, bisexual, transgender, or queer, not having equal access to social and economic resources that can protect against injury and violence. These disparities impact our economy, costing the country trillions of dollars, our ingenuity and academic achievements because we can't draw from the full range of the best and brightest minds, and our social and emotional health because we're hampered in building relationships across diverse cultures. The social determinants of health are non-medical factors that influence health outcomes. They are the wider set of forces and systems shaping the conditions of daily life. These forces and systems include things like economic policies, social norms, access to quality education, policies that impact access to employment and job security, and work-life conditions. The social determinants of health can influence health equity in positive and negative ways, and they're important elements in our strategies to prevent injury and violence and advance health equity. The promising news is that injuries and violence are preventable, and we know a lot about how to change the current reality. When we look to design strategies to prevent injury and violence, we have to understand the risks that increase the likelihood individuals and communities will experience intentional or unintentional injury. And we need to also understand the protective factors that we can leverage to keep individuals and communities safe and minimize the negative impacts of injuries and violence when they do happen. Risk factors are those characteristics, either contextual or organic, that increase the likelihood we will experience a specific injury and the likelihood that the severity of the outcomes of that injury might be more severe. Protective factors are those characteristics, either contextual or organic, that decrease the likelihood of negative outcomes and reduce negative impacts of risk factors that may be present in our lives. There are risk and protective factors that are shared among types of injury and violence and have the potential to impact more than one public health issue. This idea is important for our work because it means we can design intervention strategies with the ability to improve multiple population health and quality of life outcomes. But in order to do this, we have to look upstream at factors that impact the social determinants of health in ways that are positive and increase equity. This requires partnerships to be built across multiple disciplines. Here are some examples of prevention strategies designed to address specific protective factors shared by multiple forms of injury and violence. You can see from these examples the opportunities to address individual behavior, but more importantly, you can see when we look upstream for ways to change the context in which individuals live their lives. When we look for interventions to change environments, not just behavior, we can address injury and violence in communities most at risk by positively impacting the social determinants of health. Here's some additional examples of programs to prevent injury and prevent unintentional and intentional injury. These are being implemented now in communities across the country. You can see the breadth of strategies available to us as practitioners. We would choose among these strategies and those examples from the previous slide, depending on the context we are working in. What are the issues we're seeing in our communities? What does the data tell us about who is experiencing the most negative outcomes and who is most negatively impacted by the social determinants? Many of these programs do address multiple risk and protective factors. I hope this module has helped show you how injury and violence prevention present significant public health issues for communities across the country and how we want to be thinking as we engage in our work to prevent them. Thank you for taking the time, and please do check out some of the other modules in these series to learn more about injury and violence prevention work.